Hi everyone, welcome to HealthTech with Purpose. Today we have Andy with us doing a lot in the healthcare and health tech space. I will hand it over to Andy to quickly introduce himself and then we'll go ahead from there.
Thanks, Rushi. Yeah, no, great to be here. Real pleasure to be talking to you guys. Yeah, my name's Andy Kinnear. I was a CIO in the National Health Service in England for many years. I worked there for 30 years and I was a CIO for more than 20 of those. And I now divide my time between the College of Health Information Management Executives, Chime, and an organisation called Ethical Healthcare Consulting. So basically still working within digital healthcare, supporting the National Health Service in England and others internationally.
Awesome. That's a stellar record in the healthcare side, Andy. So, would really like to know what's your overall background on the healthcare side, an overall background and how, did you get started in the healthcare industry?
Yeah, well, it's like many people. It's always a little bit of accidental, I suppose. But I did a geography degree as my at university, and in my final year, we started to study epidemiology and disease patterns, and I just got really fascinated by the way in which different diseases affected different populations and things like that. And so I decided a career in healthcare was where I was headed, and I came in initially and spent most of my first few years actually working as a statistician. I did a lot of work around public health planning and worked with health statistics, and so really began as a kind of data and analytics person. And then, as happens often, as you start to rise up through the management tiers and you start to take team leader roles and then department roles, the expansion of your remit takes you into other areas, and I began to pick up IT teams and technology teams, and in the end innovation groups and transformation programs and all kinds of things like that, and grew out into a full sort of CIO remit. But I often say I'm a slight fraud as a CIO because I'm not particularly technical by background at all. I came in as a numbers guy, and I'm much more interested in the way in which the numbers direct us towards serving and delivering healthcare. The technology is just a part of that in reality.
Yeah, I feel being a number guy and having the domain knowledge is like a very, very awesome combination. Yeah. Great. So, how do you see the role of digital technology evolving within the healthcare, system over the next decade? What are your thoughts on that?
Yeah, so I think this is, I think the next 10 years is going to be massive for healthcare. Actually, I think the big dominant agenda will be the rise of consumerism in healthcare. I think what we've seen in other industry sectors, whether it's banking or whether it's travel, or insurance, or pretty much every other walk of life, we've seen a real transformation in those industries. And what they've been able to do is they've been able to take work that they used to do for us as their customers and hand it over to us. So we're now doing work that they used to do. But we're so happy about that because the way in which it's been handed to us on digital apps and through digital developments is actually making us more empowered and more sort of in control as customers. And you look at it, I think about the way in which maybe my travel experience has changed over the years. There was a time in which somebody else used to do all of that for me. They would book the flights, they would organize the transfers, they would sort out the hotel, and I would literally turn up and sort of do the journey. Now I'm the one booking the flight, I'm the one organizing the hotel, I'm the one organizing the transfers and so on, and yet somehow I feel more in control. And it's really clever. What they've done is they've taken work and cost out of their industry, they've handed it over to the customer, and yet the customer feels more empowered. And I think in healthcare, we're at the beginning of that journey. We have got a long way to go on it. Certainly in the United Kingdom, we've got a real journey ahead of us. But this idea that we can start to empower our patients and empower the public that we serve through the development of consumer-led applications and different services on digital platforms. But we can do it in a way that also takes cost and deburdens some of the workload that is sitting on our healthcare professionals. And I think that for me that's going to be the seismic shift. I think there'll be lots of other agenda that will play out through innovative new technologies and through the change in the way in which we can adopt RPA and AI and all of this fancy, really curly, sexy stuff. But in reality, I think that the big seismic shift will be that we will empower our consumer in a way that we've seen in other industries, and therefore change the face of healthcare in that way, and frankly take some of the pressure off off the frontline organizations who are certainly in my country are absolutely swamped at the moment, and are struggling to cope. And so actually, how do we help them? Well, we get some of the people to do some of the work for them, basically.
Yeah, and a very interesting thought, as you said, because everything is kind of going into the hands of consumers, right? And with more power comes more responsibility and more challenges. So, what do you think? What are the biggest challenges the healthcare industry is facing today?
I think, there's a number, to be absolutely honest, but I think the single biggest is going to be a workforce challenge. I think what I'm witnessing in my frontline clinical colleagues at the moment is a pressure on them like I've never seen before. They are incredibly busy. They are running like crazy to try and stand still. They're under immense pressure to deliver the workload, and we're not seeing the volume, the numbers of sort of replacement, if you like, additional new workforce coming into that space quickly enough. And I think we're going to see globally, a real talent war to try and attract the best people and to try and make sure that we've got sufficient numbers of professionals in all levels, whether that's in the clinical services or in the technology services. And so I think the single challenge is okay, well, how do you make your organization, your industry, your country, even India versus the UK on this, how do you make your landscape appeal to that group of people? And I think there's a certain amount of kind of hygiene factor required. You've got to look after people properly. You've got to pay them a decent wage. You've got to sort of provide them with the kind of things that they would expect in any good employing organization. But I think you've also got to lead them well. People, it's lots of evidence shows that talented people will stay in organizations where they respect and admire the leadership. So I think there needs to be a genuinely strong and sort of vibrant leadership to succeed. I think you need to create a mission that people want to be part of, and I think in healthcare we've got a great chance to do that. There can be nothing really more satisfying than being part of the community that are supporting the health of your nation. That's a really proud mission, I think, for most people, and so I think stressing that mission is really key. But I think the other differentiating factor will be how we develop people. The younger generations I'm witnessing are mad keen to be developed. They really want to learn, they want to grow, they want to expand their portfolio, they want to progress in their careers, so on and so forth. And I think they will be drawn to the organizations that support them on that journey. And so for me, the challenge above all else, don't get me wrong, there's huge political challenges, there's funding challenges, there's sort of global dynamics challenges, there's real interesting economic challenges. In the United Kingdom, we've got massive Brexit challenges still. So there's all sorts of other stuff that's on the table. But I think when you peel it all away, our fundamental biggest challenge will be around workforce, attracting, retaining, and developing the very best people. And I think that applies. It applies in the United Kingdom, it applies in the United States, it applies across Europe. I'm sure it applies across India and the geographies you guys are in. So I think that's the focus. People, as always.
Yeah. Exactly, exactly, and highly skilled people, people who can not just get the job done, but I would say get the job done well, because this is healthcare that we are talking about, right? So, very interesting, take on the challenges. So, what do you feel like? How tech is gonna enable solving some of these challenges? What's your take on that?
Yeah, well, so my take, it's interesting actually, because I think, as I said earlier, I'm not massively interested in technology. In a way, it's a strange admission. I feel I can say that out loud now I'm no longer in a CIO, formal sort of CIO role. I'm much more interested in the way in which we support people. So for me, the story, whenever I'm looking at new technologies or looking at, reading or listening to, podcasts or watching video or whatever I might be doing to try and sort of understand new technologies, within seconds, my brain is leaping to okay, but what's the impact going to be? What's the difference going to be? How's this going to help a nurse, discharge, his or her duties easier? How's this going to help a doctor? How's this going to help a patient navigate? Whatever it might be, I'm interested in that side of things. I think that's one sort of question I'm asking myself. The other question I like to ask, and I'm sure you've seen this because I have, is often with technologies there are some predictable benefits. We've designed this thing, it's going to do this task, it's going to solve this problem, and the benefit is going to be this. But there are also some unforeseen benefits, usually sometimes unforeseen negatives and things like that. And I'm quite interested, one of the tricks I like to play with myself is to try and understand, okay, what are the things that somebody hasn't thought of yet as a result of this of this technology. I quite like to play this little game with myself. Well, what about this, or what about the that, and play those things through. And certainly projects I've been involved in the United Kingdom, the most exciting aspect of them has been the benefits that we didn't imagine at the beginning, the things that nobody thought of before we started. And yet actually once we got into it, we suddenly started to see, services change, or doctors and nurses come up with new ways of doing stuff or things like that. And I think, for me, when I'm looking at the latest tech and trying to understand the latest technologies, I think I'm also trying to understand what might be the unforeseen benefits that this thing, whatever it is, might deliver, because it's always going to be more than people think.
Yeah, yeah. So kind of trying to wear a devil's advocate at the same time, trying to see how much extra mile a particular technology can support, right?
Yeah, well, exactly that. And I think sort of understanding which what problems it might solve, and the problems that you hadn't thought of that it might have some kind of impact on.
Yeah, yeah, totally. So that makes me wondering. So how do you approach the whole problem solving in your role as a healthcare leader?
So I'll be really honest with you, Rishi. I have got to the position I've got to in my career by walking on the shoulders of giants. So I have constantly recruited people who are much more talented, much more energetic, much more sort of visionary than me. So my major tactic on solving any of the problems that I've faced in my career has been to surround myself with immense talent who are probably going to solve those problems for me. And frankly, I just climb on their shoulders and ride that, ride along on that journey. But I think the other aspect of problem solving is it's about almost like good discipline. So be really clear about what problems you are solving, and equally clear about the ones you're not solving. So what are we actually aiming to achieve here, and then be sort of unapologetic in your pursuit of that solution. So we are here to do this. Nothing is going to get in our way. We're absolutely determined to make it happen. And then when we do make it happen, we're going to celebrate it and shout about it from the rooftops, and make sure everybody understands that we recognize this problem, we found a solution for it, we deployed the solution, and we have now solved it, and we're on to the next thing. But I think, in reality, when you know the sort of clues in the question in a way, when you're in a leadership role, when you're a healthcare leader, don't make the mistake of thinking that your job is to be solving all of the problems. Your job is to be bringing in the resources, the talent, and then giving them those folks the environment in which to solve the problem. And I think the thing that's stood me in quite good stead in my career really has been being quite hands off with my teams, being quite sort of empowering as a leader, largely sort of putting the challenge in front of people and then getting out of their way so they can they can help solve it, and then deal with the major sort of the major challenges that you get drawn into, whether that's around funding or additional resources or whatever it might be, contractual stuff with vendors or things like that. But in essence, my approach to solving problems has largely boiled down to getting people who are better than me to to do it for me.
Yes, I mean that's very interesting. Basically, you cannot be the smartest guy in the room, so that's the thing, right?
Exactly. Yeah, exactly.
Awesome. So, while doing this, I think one of the critical aspects, I believe, is prioritizing and allocating resources, right? So, how do you go about it in some of the health tech initiatives within your organization?
Yeah, so I mean, we would do some quite, sort of proven methodology type modelling of, okay, what's the investment here? What's the projected benefits look like? What's the time to deliver? What's the resource investment and things like that? So we'd end up with some fairly hefty spreadsheets with, projection and sort of, realization of benefit prediction and things like that. And largely use those as a schema for then beginning to prioritize. I think I would slightly caveat that by saying I think I also had a few other, I guess, softer criteria that would sit in play for me. So, for example, I don't think you should work in healthcare if the projects you're working on have not got a direct line of sight to the patient. So I'm interested in things that are going to benefit the front line first and foremost. So that's not to say that there isn't projects that you have to deliver and an activity that you have to undertake that does that might not be quite so clear on how it benefits patients. But ultimately, I think the role of a CIO is to make the roles of your doctors and nurses easier, and ultimately make the lives of your patients better as a result. And so, a massive factor in prioritizing projects for me was what will be the frontline impact of this piece of work, and almost what's the confidence that we've got that we can realize that and make that make that happen. And I think in a way that sort of transcends everything else, because it has a few knock-on benefits. So firstly, everybody can understand that. So when you're explaining why you've prioritized a project list in the way that you have, and why your priorities are going to be these things, you can talk about the financial benefits, you can talk about the cost savings, you can talk about the resource efforts and things like that, but everybody understands the concept of making it easier for doctors, nurses, and ultimately patients. And so it's almost a thing of beauty. You are sort of describing a reason that is so fundamental to why we work in healthcare that I think it makes it powerful. The second benefit is that when you have prioritized your work and decided what projects you're going to mobilize and things like that, then as you start to put resources onto them, as you put people onto those projects, you want those people to feel passionate about what they're about to deliver, and to feel that what they are doing is important. It's because some of this work's really tough, it's really exhausting. These are challenging projects, complex, lots of moving parts, lots of reasons to be frustrated and tired and find it difficult. And so you want underneath all of that somebody to feel the reason that they're going through all of that is because it is really important and it really matters. It's not just a priority because it's going to save money, or it's not just a priority because it's you know, it's going to give us a new piece of technology that we didn't have before, or it's not just a priority because the chief execs, you know, likes it, or things like that. It's a priority because it's making an impact for, you know, for patients, for, you know, and the doctors and nurses who serve them. And I think, and so you end up with a team that's far more motivated than they might have otherwise been, because they can clearly understand how your prioritization has worked, and the fact that what you're putting first and foremost is, you know, is the people we're working for.
Great. So, that's really helpful, and especially for some of the viewers who would be viewing the podcast. Basically, is, I mean, one of the key aspects is, as you mentioned, is what is the impact on the front line, right? Very, very, very interesting. Thank you for sharing that aspect, Andy. So, I think you are kind of dealing with a lot of projects. You have done that in past as well. So, is there a particular health tech project that you have led, and could you tell us about its impact?
Yeah, there is actually, and I'm glad you're giving me a chance to talk about this, because whatever I do in my career, this I will never do anything that will give me more pride than this particular project. It was a really, you know, important piece of work for me, and it was a program called Connecting Care. I worked for a long time in a city called Bristol in the West Country, in the west of England, and essentially, in a nutshell, what we did is we had implemented electronic patient record systems across our city, but in silos. So we had different electronic patient records in our GP practices in primary care. We had different ones in community care with, you know, district nurses, health visitors. We had different ones in mental health, supporting, you know, psychiatry and the mental health disciplines. And we had different systems in all three of our acute hospitals. Alongside that, in the United Kingdom, we have a social services, a social care set up, you know, publicly funded, and social care had implemented different systems. So across our city, we'd probably got, I don't know, hundreds of different clinical systems with medical records in them that weren't connected or were partly connected to, you know, some of the rest of the ecosystem. And we set about this program to essentially build a shared record platform and allow these systems to share their information, so that you know, a doctor in an emergency department could have access to the GP record, or a mental health you know, person could see what happened in the emergency department earlier that day, or a GP could see the discharge summary for a patient that had left hospital recently that was now under their care. So all of these bits of information that existed in these systems, many of the doctors and nurses didn't have access to and couldn't see, and therefore were making decisions, you know, with one eye closed. Really, they were unable to make, you know, the best decisions that they could. And by building a shared record program over, you know, over a 10-year period, we got to the point where we were sharing immense amounts of information. And I've got countless stories of, you know, doctors and nurses coming to me and saying what a difference it had made to their ability to make decisions, because all of a sudden they could see information on the patient they hadn't got before. And, you know, as a doctor and nurse will tell you, essentially they're making a risk-based decision. That's what they're doing. When they've got a patient in front of them, they're deciding what to do in, they're working out the risk of doing A versus the risk of doing B versus the risk of doing nothing. That's the kind of mental conversation that they're having with themselves as they're talking to the patient. And that risk decision is based entirely on the information that they've got available. So what the patient is telling them, what they're seeing in their system, and so on. So the more information you can make available to doctors and nurses at that point of care, the more, you know, the higher likelihood that they will make better, faster, safer, more clinically impactful decisions. And we saw that time and time again, that we got just better stuff happening as a result of being able to share the records. The side benefit, you know, I talked earlier about sometimes you don't see all the benefits that you imagine. The side benefit is that it actually became the vehicle through which different parts of the health community spoke to each other. So all of a sudden, our hospitals were talking to our GPs, and our GPs were talking to our mental health provider, and our community people were talking to social care and so on, in a way that they'd not been talking to them before. So we started to see other projects springing up all over the place, because these people were now friends and they'd now begun to build some kind of working relationship. So yeah, I'm incredibly proud of the impact it had. It's, you know, it saved millions in you know, in financial terms, but it's undoubtedly saved lives and improved care for, you know, for people across that community, as well as had quite a big cultural impact in the way organizations work together. So yeah, super proud of that one, and will never refuse the invite to tell people about it.
No, like pretty awesome, and I'm pretty sure everybody who must have been involved in that project is equally, you know, passionate and keen about telling the story. Because, as you rightly mentioned, not just you know, impacting all the doctors and everybody involved in the process, but it would have helped saved millions of lives basically.
Exactly.
That's amazing. And what was the duration of the whole program, if I may ask?
Well, so it's still running now. It began in 2010. So we
Oh,
started in about 2010. I think I won't bore you with the whole story, but we probably got to about 2013, 2014 before we started to have the, you know, seriously measurable benefits. But then after that, it just got better and better and better. You know, once people used it more, once you know, doctors and nurses were sort of used to it being available and the impact it could have, then it grew and grew, and we shared more information, we shared more, you know, we designed the screens in different ways to support different use cases. More organizations came on board and began to share their information through it. And in the end, we even started to do some stuff with you know, patients accessing it directly to manage some of their own care. So, you know, really, yeah, really nice project actually.
great to know about them. Yeah. And great to meet somebody who's actually leading that. So thank you for sharing that with us, Andy. Awesome. So, you know, what advice would you give to organizations looking to implement health tech solutions with a purpose?
So I think, I mean, it's a bit of a cliche to say this, but I do think it's true. The biggest mistake you ever witness on a technology project is people who believe it is actually about technology. The reality is these are people projects from the get-go. And so you know, the single most important piece of advice you can give anybody is to recognize that you are actually doing a transformation project that will require people to change the way they think, act, you know, behave, and in reality, that needs to be your primary focus, because what you will have is you will have passionate believers in that change, and you will have equally passionate disbelievers who are determined to, you know, to not move 1 inch and not change. And it is dealing with the people change, culture change, you know, sort of transformation that is really key to the technology success. I'm absolutely convinced most CIOs can deploy a piece of software successfully into their organization. You know, most good tech departments can handle the technology element, you know, relatively straightforward. Of course it takes planning, of course it takes organization and so on, but in reality, it's not the technology that you are dealing with. It is the people. And I think, you know, one of the secrets for me is to recognize that right from the beginning and work on it right from the beginning, and sort of actively manage your stakeholders, actively understand, you know, what people's different positions, you know, their sort of stances mentally on these things. And then work out the ways in which you need to nudge their behavior in the right direction, the ways in which you need to influence them to become supporters of the change. And also just recognize that, you know, some of this stuff takes time. You know, often with the technology aspect of a project, you can come up with quite a structured plan. You can be fairly confident in the deployment timetable for deploying the technology. I think when you're dealing with people, it can be a bit less certain. And so you need to sort of understand that quite a lot of that people change, culture change stuff will take time, but with some active management, with some heavy focus, and with some sympathy towards the, you know, the need to sort of drive that journey through, then you can be successful with it. I think the one sort of really key tip that's served me quite well is people will find reasons to block technology projects. They'll find reasons why it's not important to them, or they don't need to do it, or it shouldn't be done in this way, and things like that. And I think if you've got an overall purpose that is about serving the public better, serving your customers better, serving the patients better, it's very hard for those blockers to stand up to real scrutiny. So I think if you can find, a narrative within your within your technology project that points to the benefits that this is going to deliver for the patient, it is quite hard for other people to then stand in the way of it and say, well, that's not important, because, seriously, what can be more important than serving the patient? So I think, quite often I would work out at the beginning, okay, what's the story I'm going to tell here on this project? And I'm going to tell it again and again and again. And it's always going to start with and finish with the patient, because that's the story that makes the change, harder to resist. So I think it's that, really. Focus on the people. The tech will look after itself. Just focus on people all the time.
Great. Yeah, and tech, basically, at the end of the day, tech is an enabler. Purpose, and the benefits and the reason why we are doing something is key. Right? That's one of the takeaways I would take from this.
It is. I mean, ultimately, that's the point of it. And I think if you're going to be working on it, if you're part of the technology team deploying this, I mean, sure, it's exciting to deploy new technologies. It's really, it's really cool. I've worked with lots of folks who really love the actual, dealing with the tech and doing all of that. But it's a heck of a lot cooler if you can also point to the benefit that is delivering to patients. That's a really cool thing. I built this technology thing here, and oh, by the way, it went and delivered all these benefits to all these patients over there. That's, who doesn't want to come to work and do a job like that? I mean, it's great.
Yep. Awesome. I mean, it was a great interaction with you, Andy, and some of the aspects that you mentioned, I mean, really amazing. Good to learn from you. Good to learn from somebody who has implemented big projects which are still going on. So thank you for your time, and I hope everybody who's listening to this podcast has got something out of it. And that's why we are calling it HealthTech with Purpose. So that next time you're thinking about HealthTech, there has to be a solid purpose behind this, and technology is an enabler. So,
well, brilliant.
Awesome.
Yeah, no, thanks ever so much. A real pleasure to come and come and speak to you, and hopefully your listeners will sort of enjoy a few of my thoughts, and I get to spend a bit more time with colleagues in India over the months and years ahead.